Yeah, so in terms of BRCA mutation, in the clinical trial, 7.5% of the patients that they screened were BRCA positive. I think that, depending upon which trials you look, and it can range anywhere from 4% up to about 8%. But this is going to be changing because in the NCCN guidelines, the most recent version, they did update it and they recommended germline testing for all patients with pancreatic cancer. So I think that going forward, we probably will end up seeing more patients with BRCA mutation. And there are also other mutations in the DNA damage repair pathway that may actually potentially benefit from PARP inhibition, but that still needs to be studied. So I think one of the important parts about the POLO trial is this is actually the first molecularly driven trial in pancreatic cancer to show a benefit. So the patients were screened, they had germline mutations, and they actually got a targeted therapy. So this is actually the first targeted therapy in pancreatic cancer to really show a benefit. And I think this is really exciting because there are other groups that are looking at trying to have these molecularly driven trials. For instance, PanCan and Prothera have joined forces with the Know Your Tumor program, and they're looking at doing somatic testing and as well as in addition germline testing, looking for these actual mutations. And we are seeing that there is a benefit for patients with pancreatic cancer that are getting targeted therapies. So this is actually a very exciting time for pancreatic cancer.